I've been asked to give a breakdown of co-infections and infections and Lyme disease and all things that infections can cause. So if you have your blood work, go grab it. You're going to look for, we're going to talk about two specific markers today. They're called neutrophils and lymphocytes. They are found inside the CBC with differential. The lab test worth the price of gold if you know how to read it correctly. You're going to pay attention to the neutrophil and the lymphocyte marker. The neutrophil, we want to see him around 60%. If it is 60% or higher, we're talking a bacterial infection. The lymphocyte marker, the magic number is 30%. If it's above 30%, we're looking at virus, some type of viral infection. Now, what do these look like? Well, bacterial infections look like chronic joint pain. They look like messed up GI tracts. Viruses, biggest issue with this is autoimmune diseases, anxiety and depression, and chronic fatigue. Okay, so go grab your labs, see where they're at, and we can get tackling them. Now, here's the trick. When it comes to these infections, there's oftentimes co-infections. If you have one, high probability you've got more than one. So there's really no way to determine Lyme disease with your regular blood test, but you can determine if your body is fighting some type of autoimmunity. Now notice that these two markers are 60-30. That is a 2-to-1 ratio. That's a good thing. But when we start seeing numbers like 42 and 40%, and they start to meet in the middle, or you see a 1-to-1 ratio, that means your body is in an autoimmune flare. Let me give you an example of what this can look like in an individual. I saw she was in her mid-20s, maybe late 20s, well, 27, so right there in the middle, I believe. She was a mess. Got married about 2 years beforehand, and since she got married, her health just started unraveling piece by piece, where her diagnosis list was very long, her symptom list was very long, her medication list was over 10, her supplements were also over 10, if not 20. She's just trying to figure out what could help her feel better in any way. She had this autoimmune ratio, where her immune system is just attacking any part of her body. Once I was able to calm down her immune system with some high-dose vitamin D, remove the triggers, and reboot that immune system, which basically is your gut, a lot of her symptoms have been resolved. Her marriage was saved, and she actually feels like living again. This is probably 3 years ago, okay? Now, I want to show you one other example of a male who suffered major anxiety and depression and had lots of GI complaints, okay? So we're going to take a look at his CBC. We're not going to get into all these other markers, but I want you to pay attention to that number right there because we just talked about it. The neutrophils and the lymphocytes. 83 is definitely above 60%, so he's fighting a bacterial infection. That's the most dominant one. Again, major problem behind GI stress and other GI issues. When I treat bacterial infections, I also treat fungal. Co-infections are very popular. There's no way to determine fungal on this lab test, but it's typically there, which is why we see a lot of recurring UTIs. The UTIs tackle the bacterial, but it never tackles the co-infection of the fungal component. So not only was the 27-year-old's life transformed, her health was transformed. She's hardly on she's not even on any medications anymore, and on very little supplements. I remember her favorite supplement is MORS, M-O-R-S, because she feels like she has more energy with that. And that comes into this play right here. If we have elevated red blood cell count numbers, how is the body's ability to utilize those B vitamins? We gave her body the ingredients it needs to do that. and she feels more energized. Now, this is somebody else's labs, of course, but I did the same thing with him. Once we got this guy tackled, got his gut in control so he could actually eat food again, and then we were able to go back in and balance out everything else. So, your normal labs can be transformational. You just have to say, yes, I'm in. If you're interested in having me read your normal labs and turn them into real answers, healing and hope, so you can get your life back, shoot me a message. Reply to the email, whichever way you're seeing this, and let's chat. I have some new opportunities coming up.